Very good morning to everybody. On the World Autism Day, we will be having a series of online lectures to help us understand a little more about these children with autistic spectrum disorders. What we will basically focus on is, are there specific eye abnormalities in these autistic children? Do we have to do a specific investigation or a regular vision screening would help them? Are there any other components of vision apart from visual acuity which needs to be evaluated? Is there any specific way how we could test in these children and more? So let's start understanding about all of this. So autism is basically a neurodevelopmental disorder where we see impairments in social skills, communication skills and cognitive skills. Though the etiology of this is not clearly known, there's a strong genetic inheritance which is proven because of studies in twin children and also because of the slightly higher preponderance which we note in case of males. Also, there are epigenetic and environmental factors which combined with the genetic inheritance yield varying expressions in case of autistic spectrum disorder. Why basically that we're worried about testing vision or knowing vision acuity in case of these children with autistic spectrum disorder is basically that there are various vision problems which are noted in case of ASD children which may compound the social and behavioral symptoms if go undetected and untreated. The various components which could be affected include it could be higher visual functions. There are various refractive errors which are noted in these children, incidence of strabismus which is more compared to the normally or typically developing children, contrast sensitivity which could be affected. There could be abnormalities in saccades and pursuits which are basically higher or supranuclear movement disorders and also abnormalities with accommodation and convergence. Let's look at all of these one by one. When we look at the awareness which is there in parents with autistic children, there's an interesting study which was done in North America which surveyed parents of children between 6 to 17 years of age. What they looked at is the varying parameters which could be associated or which could have a bearing in with the fact that the children has undergone an eye check in the past 2 years with respect to has a child undergone an eye check and if yes, have they actually followed in terms of giving glasses to these children. What they actually concluded was the higher the parent education level, higher the socio-economic status, the higher the probability of this child was to have a eye test in the past 2 years. Or if the child had a good communication ability and a high intellectual functioning in autistic children, those children were likely to be tested in terms of having an eye examination in the last 2 years. That means those children who have a severe disorder or a moderate disorder or the parents are not aware of, they were unlikely to have a eye examination done, and there is a definite need to be aware about the need for eye examination in these children. And then we comment about when we look at the higher visual functions, what we know about autistic spectrum disorder or what we need to basically understand is when we look at a particular scene, say when we're looking at the forest, we also look at the trees. We also combine the information that there are various trees which are located and process it simultaneously, which we call it as a global processing. And when we're just looking at the tree, we call it as a local processing. What has been known in children with ASD is that they have a poorer performance in terms of global processing, that have poorer performance in terms of motion perception or facial recognition in children and also biological motion perception. So they have a basic problem with respect to processing global information was what was understood earlier. Now there are various studies which looked at is this actually true and why this bias happens with respect to local and global processing bias. So this could be because of weak central coherence theory, or it could be explained by enhanced perceptual functioning, or because of the hierarchization deficit hypothesis. The most accepted is the enhanced perception which is seen. There's an interesting study done by D'Souza et al. When they looked at challenging this concept in terms of global processing being deficient or the enhanced local processing which is there in children with autistic spectrum disorder. They did a cross-syndrome crosstalk comparison to reveal that if there are any differences. When they looked at, they compared basically local and global processing across modalities in terms of auditory, verbal, visual, spatial and levels of processing in them. They found there was no consistent local processing bias which was found in these children. What they concluded from this is, depending on the nature of the stimuli and the task, both local and global processing bias were evident in all these children with autistic spectrum disorder, though their study included other syndromes as well. And these findings indicate that individuals with neurodevelopmental disorder or autistic disorder cannot be simply characterized as global processing errors or local processing errors, and that becomes important in terms of treatment of these children. Yet another study, which was done by Van der Hellaan, showed that there was again no enhanced local visual processing nor a deficit in global visual processing, and there was a difference in the temporal pattern of local-global balance, which will have a bearing in terms of visual assessment, which will be dealt in the subsequent talks. What we understand also, another interesting study which was done in Arvind Madurai, which looked at functional and cognitive visual assessment in children with autistic spectrum disorder. So they did a comprehensive eye examination. They also did a cognitive vision assessment. When they did a cognitive vision assessment, they assessed various things in terms of color, contrast. They looked at the saccades and pursuits using NUSCO score. They also looked at mailbox directions, which the child could make out by placing the letter in the mailbox, which are indicated by directions. They also looked at the rectangle claim, how the child could respond to or identify the emotions using Heidi picture charts, and also the optical illusion. What they found was interesting. In terms of, in these children with autism, they found the color vision, contrast or perception of directionality were by and large normal. Most were not able to perform basic two things in terms of optical illusions and also recognizing emotions. Further, ocular pursuits and saccades and recognition of size differences were often abnormal in these children. And the duration of fixation with a phase target was inversely proportional to the severity of ASD, meaning the severe the ASD, the lesser the fixation to a phase target in these children. That means it's directly related to the having a poor eye contact in these children, which we know. So they concluded by saying that all the forms of ASD or all subjects of ASD have some form of cognitive visual impairment independent of the ASD severity. That means even if the child has a mild ASD, definitely has cognitive visual impairment, and thus the need of cognitive visual testing in these children with ASD. Moving on further, when we looked at visual acuity and refractive error, we need to understand the important difference in terms of when we look at the visual acuity is usually normal. That means these children have the potential to develop the normal visual acuity. Unlike in case of other neurodevelopmental disorder, where the ability to gain 100% visual acuity is a little lesser. Contrast sensitivity have been variously reported, some reporting to be normal, some reporting to be the mid-spatial frequencies to be affected. And the various studies note varying incidences of strabismus in these children, but compared to our typically developing children, there is always a twofold increased risk of developing strabismus. When we look at refractive errors, astigmatism is one of the most common refractive error noted in these children with autism. And this is basically a table looking at various studies looking at what are the refractive errors in autism. When we look at the first 5 charts which are plotted, what we notice is that most commonly in the earlier studies it was more often noted to be hyperopia. In the later studies which were noted to have astigmatism to be the most common refractive error. The interesting study is by Aniket et al. When they looked at the study, compared the typically developing children with this autism, and what they noted, this is the higher risk when we compared this last graph with the last one. What we note is the increased incidence that we note in case of autism children. Again, the astigmatism is far more common and occurs at a higher preponderance in these children with autism compared to that of normally developing children, while myopia is slightly increased and hyperopia very minimally increased. So, testing for or doing a comprehensive eye examination involving a dilated refraction to note the refractive errors become important. When we looked at our own data in the hospital between 2013 and 2018, that was a 5-year study, and we looked at 81 children, we noted that it was again more common in males as reported in all the studies. We noted that the most common refractive error noted was astigmatism as noted in the other studies as well. When we look at accommodation and convergence, what has been studied and reported by Coulter et al. Is that they are more likely to show a receded near point of convergence. They are noted to have a poor fixation inaccurate saccades, erratic pursuits, and exophoria. These occur irrespective or of the reported verbal communication level. So, near activity definitely gets affected because of all these parameters being affected, and thus testing for all these parameters become important. What we also what they have also reported is these children are more likely to have accommodative deficits, especially in terms of accommodative lag. So it's not just the refractive error, but also the accommodation, the near point of view accommodation, near visual acuity has to be done in all the children with ASD. What we looked at our own data, this was basically a DNP thesis done by our own DNP student Dr. Deepthi, who looked at evaluating the various ocular anomalies in patients with ASD and study the outcome of vision therapy, directed vision therapy for all these children who are noted to have abnormality. This was done over a period of 9 months. It was total of 45 children. What we noted was sustained fixation was poor in around 50, half of them. Saccades and pursuits were affected in nearly 3/4 of them. Mean near point of convergence was a little receded. When we did a Taylor vision therapy, it definitely showed an improvement in all of the above. Though it was just a 1 month of vision therapy, it did show a difference at the end of the therapy. So what we intend to say by all this is that these parameters are to be checked in addition to the visual acuity testing, and a tailored vision therapy definitely helps in overcoming all these abnormalities. The COVID-19 has posed us unique challenge in terms of children not being able to come and in-person assessment being a problem. So Bishop et al. Looked at how we could help these children out, and this was a study published recently which looked at or which suggested that having a hybrid model of assessment both in person and online could be a way forward, and also involving the parents and the pediatrician who was in charge of, and making a adaptable, sustainable and equitable family centered system of care goes a long way in these children, in helping these children with autism. And so what I conclude by saying is that the children with ASD disorders have a gamut of eye and vision abnormalities. There's a definite need for a comprehensive eye examination in these children, not just a vision screening. The examination technique need protocols to be tailored according to the individuals with ASD, and vision therapy in these children definitely makes a difference, and a structured cognitive vision assessment in addition to the routine eye examination is also the need of the hour. Thank you very much for your patient listening.